Hey, thank you for joining me today. I'm really excited to have a special guest, and I'm going to let John, introduce himself. But I will say John is a recent graduate of Missouri Western in the Bachelor's of Social Work. He has a BSW. He is pursuing his MSW, and that's very exciting. And we are champions for John. So, John, maybe for the viewer, tell us a little bit about yourself. Who is John Stuart?
Well, I'm 47 years old, and I have 4 kids, and my second oldest son is actually in the hospital right now, who just had a heart transplant. So, I'm a loving, caring father, and I've been through a lot of life experiences that necessarily wouldn't point for me to be in this position right here, but through change and like standing up for myself and learning how to believe in myself, I've been able to become present in the moment and to achieve things that I didn't think I could achieve.
All right. So, do you believe in change? That people can change?
I absolutely do believe in that, and I'll tell you why. Because at the age of 15, I started using drugs, and I started having kids, and I used drugs until the time I was 39. And I've been to prison twice. I've been to 4 different treatment centers. I've been to multiple county jails, and I never thought that I could be doing what I'm doing right now. But through a painful experience of sitting with my oldest son in the diagnostic center in prison, and being able to feel all them feelings, that pain was enough for me to want to do something different with my life. And so I got involved into a program, a 12-step fellowship and program that has allowed me to remain clean, because I could stop using, but I could never stay stopped using. And now I've learned how to do that.
All right. So that being in that program, or was there something else that motivated you to social work? Why social work? Why not business degree? Why not a nursing degree? Why social work?
Well, when I think about social work, I think about working with homeless people, children with trauma, drug addicts, and a variety of other people. And when I think about my childhood and my ACEs score, there's 13 points or something like that.
Well, the newer ACEs, yes. The old ACEs was a 1 to 10, but yeah.
Well,
yeah.
I hit 12 of the 13. My mom's mentally ill. My real dad's legally deaf and was never a part of my life. My son's got medical issues. I was adopted. I'm a drug addict. I've been homeless. And I just felt like I could touch a lot of different areas through lived experience and really make an impact.
Yeah, plus into prison.
Yeah.
The violence, treatment, the things that those kind of things are also bring to the table experience-wise. So, all right. So I have had the opportunity to have John in multiple classes here at Missouri Western, and John always sat on the front row of class, usually with a big jug of water, but always, every class, front row, right in front of kind of where we would have our computer PowerPoint set up. John, why do you sit on the front row? And I by the way, I'm asking this because I know that there is a story behind it.
Yeah. Well, in the program I attend, when you sit on the back row, we call that denial aisle or relapse row. And I want to sit in the front row because it was the emergency room. I needed help, So I don't sit in the back row because I don't want to get distracted. I can't hear very good, and I want to be able to make sure that I get everything out of the class. And it didn't start here. It started my first class in my associate's degree, and I still do it today in my master's class.
And you deserve to be on the front row.
Yeah.
Yeah. And were there ever times you questioned whether or not you were worthy enough to be on the front row or to sit on that front row?
Yeah, I never thought I was worthy enough. Self-worth has always been an issue for me, because when I got adopted, my grandfather and my grandmother adopted me, but my grandpa would never let me do nothing because I was always hyper and I wouldn't do exactly what he said. So I always felt less than. And like today, through working that program, and because there's 12 steps, and the program is working in 12 steps, and in working in 12 steps, I've learned who I am, and I learned my true value is in being myself. So I know I'm worthy today to sit on that front row.
You are, absolutely, absolutely. So, next question, you've actually answered part of that, and that is, what have you learned about yourself from, getting your bachelor's degree? Part of that was that seed that was planted in those, the early treatment days, the 12-step group, realizing that what your self-worth was. But in the last year, as you really went from being a junior to a senior and graduated with your bachelor's degree, the cap and gown, what looking back on that last year, what did you learn about yourself?
And I learned that at the beginning, I didn't think I could do it. But I know through hard work, integrity, and some other things that I call spiritual principles, what other people call values, that I can achieve anything. If I just set my mind to it, and if I do my part, I believe my God will do the rest. And it's always panned out for the last 8 years.
All right. So, where do you see yourself, say 5 years from now? You get your master's degree, and 5 years from there, where can a listener or a reader of this article find John Stuart? Where are you going to be?
Well, I was really thinking about working with the homeless or kids, but the more I spent the last week in the hospital, and to watch how caring and compassionate and how much they help people in that setting has really been attractive to me. And I think that my route is switching to wanting to work in the medical field with families who have kids suffering like I do.
Yeah, and that's one of the beauties of this degree, is that as life changes your lens or your view of the world, having that bachelor's in social work or that master's in social work allows you to shift, gears. I, for many years, did private practice with kids and child welfare. But I'm in a place in my career where I don't carry a caseload. I don't want to do therapy anymore. I'm interested in teaching full-time and the macro level practice. And I think that is one of the things that you figured out early on. You can always work with kids, but as your interest in life, throws different curves at you, you can take that education and use it in any different direction.
Yeah.
So.
Yeah.
And sometimes part of that is also figuring out what you don't want to do. And I know, because you and I have had some conversations, what is it you don't want to do with your social work degree?
I do not want to be a substance abuse counselor. And the matter of fact, the job that I got now, when they tried to hire me, they wanted me to be a substance abuse counselor.
Because you had successful recovery,
Yeah, but I also know that the number one cause for relapse in the program that I am in is people who are substance abuse counselors, because they spend all their time focusing on everybody else and they forget about themselves, and then they slide back off, and it's a real slippery slope. And also, I'm a sponsor, so I already work with individuals through the program I'm in. So, I can use my knowledge and my lived experience to help other people.
Yeah, and being a sponsor is a great way to sort of practice what you've learned. Someone else had to be your sponsor, you can be someone else's. But just because you have made it through recovery doesn't mean you just want to do substance abuse.
Right.
And if anyone was to lump you into that, that would be an incorrect assumption on their part.
I actually turned that job down.
Yeah.
Yeah, that practicum / job. And then 5 minutes later, they called me back and was like, how would you like to be a case manager or CSS, community sports specialist, which actually gave me bachelor levels pay as a senior. And I had not had my bachelor's yet. So it all worked out.
It all worked out, yeah. It's hard to sometimes say no, but having a clear understanding of what you don't want to do is a great way to launch about what you do want to do.
Right.
So, last question. what advice do you have for future social work students, whether they be bachelor's level or master's level?
Well, one of the things I struggle with a lot is not thinking I can do the assignment. But when I get to that point, I just got to start. One of my English teacher in my first year in associates degree, and she always said, just start typing. And then I'd start typing, and then I'd have to erase all that, but my mind would be going, and then I could do the assignment. So I just started the assignment, and then when I get to where I feel like I'm comfortable with doing the assignment, I just push that to the side and I do what I was supposed to do. So I just never give up, because anything's possible.
Yeah, I think that's really important. I will say to the listener and to the reader, Missouri Western, we're in the northwest corner of the state. We do get a lot of students from the east side of the state who come from low socioeconomic backgrounds, who haven't maybe had the most college prep, high school courses, but that doesn't mean they can't be great social workers. Because they have a heart and a passion for caring for others. What am I first, a professor or a social worker? And at the end of the day, I'm a social worker first and professor second. So it is about giving that message to students. Just get on the horse and start riding it. Get on that laptop, start typing it, and not worry about it, because it will come to you.
Another thing that made it so tough for me is, like, when I started using it at the age of 15, I also quit school. So when I got out of prison the first time, within the first month before the drugs took back a hold of my life, well, I believe it's the disease of addiction, but I was able to get my GED at the age of like 19. And then coming into school at the age of 42 and not really having experience from the freshman year to the senior year, it was really difficult. But it was, like I said, if I do my part, my higher power, who I choose to call God, always does the rest.
All right.
And another thing I want to say is,
yes,
always be kind to people.
Yeah, absolutely.
Yeah, help people when they need help, and don't look down on nobody, because you might find yourself in that position. So just treat people how you want to be treated.
Yeah, living the golden rule. That's
Yeah.
right. Treat people the way you want to be treated. So, hey, thank you so much, John. I appreciate it. Thank you so much, reader and or listener or viewer. If you have more information about social work, please reach out to Missouri Western School of Social Work. And thank you, John. Appreciate you, brother.
Yeah, appreciate you.